What up, young scholars? This is your boy, the extra large professor. And today I'm here to react to HBO rebooting of In Treatment. First and foremost, if you ever watch any of my YouTube videos, you know that I always focus on hip hop and fatherhood. But I have to break that mold just for one moment because In Treatment is very, very special to me. Because In Treatment was one of the shows that really helped me as a dad to get into therapy. As I stated before, as a professor, I want y'all all to know I am a professor of English, and my area of research really looks at not only American literature, but I also look at fatherhood narratives as it relates to hip hop lyricism as well as hip hop culture. But In Treatment, again, it's near and dear to my heart because it is Blair Underwood's character as Alex back when it started back in 2008 that really gave me the courage as a Black male and as a dad to go out to receive therapy. And I would say it was life-changing. I want to say as a result of going into therapy, for myself, I became a better dad, became a better husband, became a better man. So In Treatment, like I said, is near and dear to my heart, played by Gabriel Bryn. I believe I pronounced that name correct. If not, you know him in Usual Suspects. He's one of the head. He was one of the former detectives in Usual Suspects, but he played the great Paul Weston. So I always remember that character. But let's get on with the review. So the new season 4, which in actuality is really just a reboot of In Treatment, stars UzoAduba, and you guys know her as Crazy Eyes in Orange is the New Black. First and foremost, she is amazing, truly beautiful and talented actor and artist. And I was happy when they cast her in this role to serve as the new therapist in Treatment. And so I just have to get like right into this review. First and foremost, this Sunday we were introduced to two patients slash characters. Eladio, which is played by Anthony Ramos from Hamilton, and from one of my favorites, She Gotta Have It, the reboot Spike Lee Netflix series, as well as a character played by John Hickey. His name is Colin. And first and foremost, as a therapist, right away, what I see in Uzo character, which her name is Brooke, Dr. Brooke. And Dr. Brooke right away is following basically Paul Lee from In Treatment. If you don't know, In Treatment featured the work of a psychologist who himself was struggling with boundaries. And once again, in this particular series, what you find is Brooke immediately has issue with boundaries when it comes to her patients. We are shown right away that she is dealing with the loss of her dad, who recently passed away, and she allows her clients to call her, her client Eladio, to call her like well into the night, well beyond the office hours. And this is a clear violation. Now, the only reason why I know that is because I'm married to a therapist. So I know it's a set amount of time and hours that a patient can call. But anyway, right away, you find the crossing of boundaries in a sense that she is really being a maternal figure for him. He is a young Latinx caretaker who is struggling with bipolar. And right away, we find that, he is seeking some sort of help to, to deal with his insomnia. He's been a caretaker for years, and he has been, in a sense, traumatized by all the patients that he has become close to that happened to pass away when he was working in a geriatric unit. So now he's working with a young man named Jeremy, and right away we find that he is struggling to to sleep, struggling to find professional distance when it comes to working with these patients, because he's always in fear that they're going to die on him. um, right away, what I found quite problematic with Brooke as the therapist is right away she's allowing him to cross boundaries by calling her mamacita and that sort of thing, like basically terms of endearment, and they're only 3 sessions in. And so right away you're seeing those sort of crossing of the boundaries, but you also see her as really a professional, really digging into some of the core issues that that character is about to face. So, so far I'm intrigued, and I'm looking forward to see, how deep this relationship will go in terms of getting him the help that he will need to continue to function as a caretaker with that fear of his patients will die. um, again, in treatment is being filmed in a time of COVID. And so this work is so invaluable, especially for those who are in the nursing field and that sort of thing, who are caretakers, who happen to, who are losing or who have lost tons of patients because of this pandemic. So it's really tugging on the heartstrings. It's really something that I think, many people in the healthcare profession should at least watch as a sort of cathartic way to deal with some of that loss. On to the second character, which is Colin. Um, he is an inmate, or soon to be. Well, he is currently an inmate that is on probation. He is, basically has to go through a psychological evaluation, which is also being done by Brooke. And he needs this in order to be awarded his probation. So basically, he has 4 weeks. He committed this white collar crime. Um, it looks like embezzlement and fraud. But right away in the show, he's being very evasive. He's being misogynistic. He's being, covert racist in the take. And what I like about her approach, which was different from Paul, if you ever watched the original first 3 seasons of In Treatment, currently featured on HBO Max, Paul was kind of known for the pregnant pauses like that. He would do stuff, and then he would ask his patients lots of questions, kind of getting them to unravel what was going on. But what I like that Brooke is doing is she's very direct and calls him out on his stuff. And she was like, okay, I notice you're being evasive. Like, why is this? You have done everything as that you can to offend me as a woman, offend me as a professional, offend me as a person of color, but yet I'm still going to be here to help you to get through this mental health struggles. Um, Again, powerful character. She has 2 more clients that's coming on tonight. I strongly recommend watching the show, especially I would say for communities of colors, that oftentimes in our communities, it's like a stigma attached to mental health. So this series right away is actually showing diversity, a diverse cast that we typically wouldn't think of when it comes to shows that show therapy. So we're dealing with that right away. And also, I think it would be invaluable for women, especially women of color that are currently in school for to become a psychologist. I think that character would be a source of inspiration to empower women to know that they are desperately needed in this time, especially in this time when it comes to the mental health field. So again, I recommend this series for dads as well. A lot of us as males are kind of taught to repress a lot of feelings except for anger. So again, this film was the film for me that helped open my mind up to therapy